I'm Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon practicing in Aestiva Clinic, Saket. Today in this video, we're going to be talking about surgical versus non-surgical or liquid rhinoplasty. So we'll be discussing as to who is a candidate for which rhinoplasty, what are the pros and cons of either, and what you should be searching out for if you're planning either of these processes. The first thing is who is a candidate for the non-surgical treatment. Now, everybody prefers something which is quick, which is painless, which does not leave any visible scars. So obviously, we get a lot of questions regarding whether the nose issue can be fixed with non-surgical rhinoplasty or liquid rhinoplasty. Now, here I want to clarify two things. One, that fillers are not a remedy for all your nasal problems. So when it comes to the cosmetic part of it, filler can address, say, a deviated dorsum, a deviated nasal bridge to a certain extent. By that I mean a crooked nose, by camouflaging the deviation. It can also work well if you have a flat nasal bridge and you want that the height of the nasal bridge should be increased slightly. So these are the two conditions where fillers work really well. Also, if you want a certain definition to the tip, so a little bit of filler placed strategically on the tip of the nose can also make the tip look a little more pointed. However, for most of the other things, like say, especially if you have some functional issues, you have a breathing problem, you have a deviated septum, you would require a surgical rhinoplasty because there's no way a filler can correct those functional problems. And among the cosmetic problems also, there is a lot of scope of improvement when we are considering a surgical rhinoplasty. So what all things can we improve? We can fix a deviated septum permanently. We can resolve the breathing issue thereby. We can also make the tip sharper, and most importantly, we can reduce the size of the nostrils if you are wanting a narrower nose. Other problems, say a droopy tip or a bulbous tip, a tip which is too long or a nose which is too long, can all be fixed by a surgical rhinoplasty. These things are not really possible doing a liquid rhinoplasty. Another common concern which a patient might have is that my nose is too projected, that is, it looks too far away from the face. Again, that all can be fixed only with a surgical rhinoplasty. So now again, the other question which people ask me is that if I do a non-surgical rhinoplasty for the indications I mentioned above, that is for a deviated nose or for a nose which is too flat, how long do the results last? Now, fillers which are used in the nose generally will last you for a period of about 18 months to 2 years. There are a lot of factors into this. One is the type of filler being used. The more standard fillers, the international brands, they would last you for about 2 years. Also, there is a lot of lifestyle factors when we consider the life of a filler. So anybody who's into active gymming, works out every day, is more likely to dissolve the filler faster because the body also metabolizes the filler. So if you're into extreme workouts, then your filler is going to last for a shorter period of time. Again, smoking is one factor which can affect the life of a filler. So we'll always tell the patient that yes, on an average, it's going to be about 2 years. But again, a lot depends on as to how you modify your lifestyle if you want the filler to last longer. Now, on the other hand, the results of a surgical rhinoplasty are going to be permanent. So that's again a very common concern. People come and ask me that, doctor, आज आपने सीधी कर दी है, कल टेढ़ी तो नहीं हो जाएगी. That is again a question which I get asked very often. So no. Surgeries are permanent, surgeries are forever. So you don't have to worry about having to redo your surgery to, maintain the result which you have obtained during your surgery. Now let's talk about the cost factor. So obviously something where, the amount of work done is more and involves a surgeon, involves the anesthetist, involves the operative facility. This is going to cost way more than just fillers. So fillers would cost per ml. So the cost of fillers for the nose per ml would be about 25 to 30,000 depending upon the kind of filler which is used, and in general we use about 1 ml of filler only for a liquid rhinoplasty, barring very few conditions. On the other hand, surgical rhinoplasty will depend upon, the cost of a surgical rhinoplasty will depend upon a variety of factors as to what all issues you need to be addressed. So if it's a tip plasty, it will cost a little less. If it's a septoplasty, it might cost a little lesser, because we are focusing on just one part of the nose. But that's seldom the case. When we're doing a rhinoplasty, it's a comprehensive job. You're working on the tip, you're working on the nasal bridge, you're working on the deviated septum, you're narrowing the nostrils, and you're also, increasing or decreasing the length of the nose in most cases. So that's why the range of a rhinoplasty is going to be something between 90,000 and can go up to 2.5 lakhs in difficult or in revision cases. However, you have to bear in mind that this is a one-time cost and you cannot compare it with fillers, which are not going to address all your issues and more so are not going to be permanent. So before really deciding as to what you need just on the basis of cost, do have a consultation with your doctor who will tell you what best you are suited for. Temporary camouflage works only in certain cases, but if you really have issues with your tip, say the bulbosity of the tip, non-surgicals are not going to provide satisfactory results. So to summarize it, each of these procedures, the non-surgical rhinoplasty or the surgical rhinoplasty, both have their benefits and their disadvantages. It's best for you to have a frank consultation with your doctor as to what expectations you have out of the procedure, so that both of you are on the same page and can deliver results as per your expectations. This summarizes rhinoplasty in both its forms, and please feel free to reach out to us if you want more details about any of these procedures, and we'll be happy to help you. Thank you.